We do, and it's called an LNAP procedure. It's laser assisted new attachment procedure. So what you do is we have the patient come in and we do a very thorough cleaning. Usually they're numbed. And this is not for everybody. This is somebody that's really struggling with bone disease, gum and bone problems. So again, their bone should be here, and they're losing bone, and we don't want their teeth to get loose. So one of the things, and it's kind of sort of a new procedure, a lot of dentists don't do it, but we take a laser, and the neat thing about laser light is it attracts the diseased tissue. So it leaves the healthy tissue alone, but it will attack the diseased tissue. So around a tooth, you put the laser down there, and you'll see the light going down, and then you bring it out, and you'll find a lot of that bacteria has collected, and we clean it and go back down again. And we do actually a series of those, and as we go on, boy, less and less of that diseased tissue comes up. And the first guy I did this on, I did it probably 10 years ago, and I have a good friend who's a gadget guy, and he got one of the first lasers, I think, in Texas. So I took my patient up to my friend's office, and we used his laser, because this man came to me he had all kinds of crowns and bridges throughout his entire mouth. He had so little bone. I was worried the next thing we're going to be doing is taking out a bunch of teeth. And that was probably, I'm going to guess, because I'm not looking at his chart, but probably nearly 10 years ago, we haven't taken out one tooth. So that was a really great success story. And I've used it on others.